Thank you for registering to the Reverse Thyroid Disorder Using Ayurveda webinar. My name is Sonika and I'm one of the panelists representing Alternative Health. I just want to talk a little bit about Alternative Health. Alternative Health is the first telemedicine portal dedicated to complementary and alternative medicine, which is rapidly being used by more than 38% of population all over US and 50% in the rest part of the world. Alternative Health is a platform designed in a way that all of our subscribers can have 24/7 access to alternative therapy professionals throughout the world. There was no proper hub for alternative medicine till now, and the search is finally over. Alternative Health comes with a platform for contacting specialists, taking their therapies and advice 24/7 through our established platform perfectly designed for alternative telehealth. Alternative Health is committed to helping you live a life free of medication with side effects. Under the guidance of Dr. Emmanuel Joy, you will be able to eliminate medicine and reverse thyroid through Ayurveda. This webinar has been formed to help you understand the causes, symptoms, diagnosis, and the treatments of thyroid disorders. It is a great honor for me to introduce our speaker, Dr. Emmanuel Joy, who will be sharing his expertise in reverse thyroid disorder through the wonders of Ayurveda. Before I give the platform to Dr. Joy, I would like to speak a few words about the experienced and well-known Ayurvedic specialist. Dr. Joy is an Ayurvedic physician in Puducherry. He has 20 years of clinical experience in this field. He is a passionate Ayurvedic physician who has a good command over Ayurvedic clinical practices and procedures. He conducted medical camps, healthcare awareness programs to a lot of public in the Puducherry region, and also student health awareness camps in different government schools and colleges. And also he has taken classes for Ayush doctors for Himalaya Company Doctors Meet and Greet Program, DMP, regarding thyroid disorder, cervical spondylitis, immunity stress, pain management, and liver disorder. Now I request Dr. Emmanuel Joy to present today's session. Over to you, Doctor.
Yeah, so good morning in India and good evening in West. So I am here to talk about how to reverse thyroid disorders using Ayurveda. So first we should know what and where is thyroid. Next slide, please. So actually thyroid gland is a butterfly-shaped gland around your neck. So in front of the thing. So this recently it has been creating a lot of issues with a lot of stress, lot of hormonal imbalances, the dietary changes. Everything is affecting this. Not only this, most of the internal organs are getting affected, and one of the cause which we are here to talk about is about thyroid. Okay, so it's a butterfly-shaped, as you can see in the screen, it's a butterfly-shaped gland. And the malfunctions are mainly either it is the thyroid gland secretes 3 hormones mainly, T3, T4, and TSH. Whereas T3 and T4 is on the high, you get hypothyroidism, and when it is low, you get hypothyroidism. So what happens is that when these two are low, the thyroid TSH, the thyroid stimulating hormone, is on the high. So that's how we find it out. When it is low, the thyroid stimulating hormone gets when it is high, the thyroid stimulating hormone gets low. So that is actually in the modern concept. Recently what we found is actually many people who are, because even if you see my testimonials, we see that the TSH becomes normal. But recently what we have found out is we not only need to test these 3, we need to test the thyroid antibody, because right now, since it is coming under the autoimmune disorder, we need to clearly check whether the antibodies are also present, because a familial tendency is also seen, hereditary tendency is also seen in this autoimmune disorders. So that way, when we need to look at it, so we need to test for the antibodies also. Okay. So that is what we have been recently doing after posting all these testimonials earlier, I saw that thyroid, even though that TSH is becoming normal, the patients are not completely getting over it. That means there is some antibody presence. In such cases, we have got severe. We need to look at it with the severity. Patients are actually suffering a little more severe than what we thought. So that change, Ayurveda provides for that also, whereas modern medicine is actually lacking in that area. Because why mainly is that the toxin removal is actually missing in Ayurveda. The next slide, please. So that is where actually where we come to that. So there is, as we saw, that hypothyroidism. The common symptoms when you see, actually, what is the thing? The people are actually stressed out. A lot of stress, mainly the lack of sleep, stress, then sudden tiredness because of the stress. Always tiredness is there. They always want to lie down. The mood swings are there. There will be sudden increase or decrease as per the condition. Sudden increase or decrease in weight. Then bulging eyes, menstrual complaints, infertility, depression, hair fall, and now we see vitamin D deficiency also we see. And then some sensitivity to heat, reduced absorption. So then there's fluctuation in the heartbeats, skin changes are there. Sometimes mostly increased hunger, sweating inside the palm. These are all many symptoms which we actually see in the thyroid thing, in the different manifestations of the thyroid thing, where only the goiter is mentioned in Ayurvedic text as it is as Galagandam, but we take it as a wholesome treatment, so we do that. It is mainly due to the unhealthy, stressful, inactive thing, and ladies are more prone to it. That's why we see ladies on the picture also, because 1 out of 8 women are actually suffering. That's what the statistics are saying, and many do not know that they are actually suffering from thyroid. That is what is actually happening, and many are on lifetime medicine. So those people who are actually joined, they would have been mainly coming here because they just want to get rid of that medicine. So we are trying to help you with that. Okay, next slide, please. So just as I was telling, Ayurveda, we take it in 2 different things. One, we need to, in a mild cases, we do a shamana. Shamana is actually a pacifying diet and pacifying medicines alone. So if you are severe, if you come into the grade of severe, then we go for a cleansing process. Okay, so that is the 2 main things. So we need to look at the patient and see the severity, whether he is able to bear the strength of the medicine. That also has to be considered. So it is not only the strength of the disease, it is also the strength of the patient which has to be considered to whether he can undergo the cleansing processes in Ayurveda. So depending on that, we change the treatments, and it is more personalized. So those things which I am going to tell you, all your Ayurvedic doctors may not say, because according to that particular patient, it may vary here and there. Okay, so that is what actually we are going to look at it. Okay, next slide, please. So in that, mainly Ayurveda, what has thing, when you have a milder thing, as I was telling, we go for the decoctions like Varnadi, Bhratyari, Punanavadi, or cleansing thing. Okay, sorry for the thing. So when mild thing, we treat with medicines like Kanjana, Ragulu. So we have got in each format, that is in a decoction form, in a arista form, or a fermented form, in a powder form, in a tablet form. We have got many medicines for that. So I'm not going to look into that all that. The second part is the body purification part. So when it is severe, we go for the body purification, because this is one thing which actually is missing in what I say in modern medicine, because the purification process is only told in the traditional systems like Siddha, Ayurveda, Unani, all those things have got that purification thing, wherein we cleanse through the different orifices in our body. Okay, next slide, please. So in Ayurveda, we mentioned the Panchakarmas. So we have got Vamanam, Virejanam. So Vasti, Nastyam, Rakta, and Rakta Mosha. So it is all different. Vamanam is through the mouth, Virajana is through the anus, Vasti is through the enema. This is actually the enema. And Nastyam is through the nose, and Rakta Mosha is when spread all over the body with the bloodletting. So these are the five cleansing processes which is mentioned in Ayurveda. Next. So when you talk about, I do mainly for this one Vamana, because Vamanam is the main thing which is mentioned for the kapha disorder. So and above neck, what all problem you have got. So when you say neck, the root of the neck. Actually. So thyroid also comes in this neck area. So all those cleansing through the mouth is done by the process of Vamana. So Vamana actually, we have found that Vamana clears up the entire phlegm, the mucus which is collected, the toxins which is collected in your, obstructing the blood flow to the brain and obstructing your senses. These are all things which we found excellent result in through Vamana. So that is mentioned perfectly, and according to the person to person we do. So and in every year I normally after this is the time when we do the Vamana. Actually after that Magara Sankranti or the what do you call the solstice, it's a summer solstice. So the Magara Sankranti that is coming around January 15th. Here it is in Tamil Nadu. It is called Pongal, and in Andhra also you have got the same thing. So Magara Sankranti we call it. So during that time when the sun, it is actually when you compare it to in a European climate, it is the spring. The spring, when sun's rays fall on the snow and it starts melting, so then it's easy to cleanse like that. So the same thing happens in our body also. So when sun is coming brighter, so the phlegm will start melting, the mucus will start melting, the toxins will get shaken up. So it is easy for us to throw it up. So it's like that. So that is the main procedure in Vamanam. So depending upon, like I said, depending upon the strength of the disease, depending upon the strength of the person, and what all he is able to tolerate. Because normally we give, I give around 2.5 to 3 liters of milk and then give some internal medicines to make the entire thing come out. So when that happens, the entire thing is shaken up, gastrointestinal tract is shaken up, and that suction pressure leads to the phlegm and everything from the head also to come down. Okay, all the sinuses are cleaned. So immediate results what we see in Vamana is actually the cough, asthma, wheezing, all those things and all will immediately get cleared in one day. But slowly the lung, the head, and the circulation will get, you can see the differences in maybe 1 week to 2 weeks. Okay, so that is what actually happens. So that's a cleansing process. So main other thing. The second one next is the Virejana, wherein we flush the toxins down the line. So you can see the picture. From mouth, when you give the medicine, it cleans the entire tract till the ends. So it is called the gastrointestinal tract. The entire tract is actually cleaned by medicines. So here what happens is I give it a grading also here also. When for a mild case, what we do is just like how you clean up your wash basin. You put a powder and then you put hot water to clean your the pipe out from the wash basin. So just like that, we have got a milder versions of Virejana. Or if you want a stronger one, we have got medicines also for that, because the cost actually varies. I have dealt with medicines from normal 5 rupees to 3,500 rupees for capsules. Because those capsules, costly capsules, are actually taught from my father-in-law, so who was a consultant to the king of Cochin. So what they do is actually it's a one-day cleansing. Earlier the kings used to do this one-day cleansing. So because they are very busy, normally that actually with old civet cat's gland, all those things, rare medicines, they use it to cleanse it, because they may be poisoned slowly. You would have read in the history that Napoleon, many other great leaders were slowly poisoned, so to kill them. So to remove that thing, Indian kings had a very good thing in Ayurveda, which is called virajana. So the cleansing, body cleansing. So here in thyroid cases, normally I start with the virajana, then only I go to Vamana, because virajana is a very milder one, and it clears the gastrointestinal tract first. So once that is cleared, all the toxins in your tract, the main tract, as we say in SUA system, the main line, when you clean it, the sidelines will push in more toxins into your main line. So then again, we need to clean it. So that's how we do it. So every 3 to 6 months, we do virajana. Vamana once in a year is normally enough. Very rarely we do it twice in a year. So that is the two main cleansing treatments which you do. The third one next is the nasya, wherein we clear up the blood circulation, nervous control to the head, because head is supposed to be the main nervous controller. So mainly when people who are stressed, who have sinus problems, cervical problems, obstruction in the blood flow, nervous conduction, all these things we clean up through the nasya, wherein we pour different decoctions, oils, juices, whatever you can, even powders, we insert through the nostrils and clean up the entire channels. First day, it will be only the tract which is getting cleaned. The second, third day, and all slowly, the more days you do it, it is more deep you go. Okay, so your doctor, if he is advising 21 days of nasya, that means he wants to go very deep into your system. So that is depending upon that we do it. And now after Corona, we would have seen even as the central government, the instructions in the Ayush books, Anutailam, nasya with Anutailam is actually mentioned as a very good treatment to prevent even Corona. So that way it was there, and it is told from birth to death. You can pour Anutailam. So just to cleanse it. In certain olden traditions, we have seen that people used to pour gingerly oil, 1 or 2 drops into the thing. So then, when you want to make it stronger, you go for juices of tulasi, tumba, all those things. You go it deeper. So this is another cleansing processes. These are the main 3 cleansing processes. The other 2, vasti and raktamoshana, very rarely we need it in our thyroid management. Okay, next question. So these are what mainly the Ayurveda says. So then, when you come to stress and stress control and mobility, relaxation, all these things, yoga also is gaining its importance now. So there are many yoga poses which can stimulate thyroid functions. Initially, like I said, the milder versions are actually the Surya Namaskar is one of the best one, because if you can do it daily, it is actually excellent. So even if you do it in the sun, because many people don't do it, it is supposed to be the Surya Namaskar. You are giving salutations to the sun. So once you do that, actually it has to be done in front of the sun. And many people don't do that. So when you do that, actually what we are expecting is the sun's rays should fall on your entire body, especially on your back, the spine. It will stimulate the bones, which is the manufacture of blood, which strengthens the nerves, so that calcium, vitamin D secretion, because sunshine vitamin is vitamin D. So that way, I have seen wondrous thing the sun itself can do in my practice, which we can talk later. Not related to thyroid. So, but slowly, when you can see that when your system is all getting cleaned up and active, this autoimmune disorders actually can disappear. So that is what we are coming. So in this, there are many yogas which you need to go under a very good yoga teacher. I would suggest certain things because there is that Sarvangasanam, and then you have got Sedubandhasanam, then you got Marjarasanam, the cat posture. Then you have got this, what do you call, Sedubandhasana, I think. Then there's one or two new things which I have seen, Dang Vidya, wherein it is mainly for the neck. They do the exercises for 5 minutes. Actually, it is very good specifically for the thyroid, because neck exercises when you do, it is actually very good for the thing. Then you have got Ujjaini pranayama, which you can do. Pranayamams are actually good to cleanse up your entire system also, because when more oxygen is getting into your thing, you find that it is excellent. So that is one thing which we do. When more oxygen gets into your system, the cleansing part is a little more better. So that is a thing. Then you have got Simhasana, where you sit in Vajrasana and then just like a lion, taking out your tongue and breathing it. So that immediately affects the throat. So those things which are affecting the immediately having the action on the throat is still more better. So I think these are a lot of, I suggest mainly thing, depending upon the patient's condition. We have to see whether he has got cervical spondylitis or some other problem. So I am not telling that you should do only this. You have to talk to a very good yoga instructor who's nearby you and whom you can relate to, and tell all your complaints, and then let him form a chart for you, which you can do it regularly. Because I normally tell, if you start into yoga, you should do it daily. Then only it will be most effective. So yoga has to be done at least for 3 months till you completely see the differences in your thyroid function. Okay, next please. So this, when you come to the dietary thing, yeah. So see, we say that food is also acting as a medicine. So the main thing is, what we suggest is actually all green leafy vegetables are okay. So that is the main thing, and all nuts are also excellent. Only thing is that there is a little confusion about the cabbages, the cruciferous things, plants called cabbage, broccoli, cauliflower, etc. What we found is actually you should avoid eating it raw. That is the main point. If you cook it with the turmeric and all Indian masalas, it is not so difficult, because I have met leading naturopaths, and they have also told me only when you eat it raw, only it is actually causing a little bit interference in the thyroid functionalities. Okay, so when you use it cooked, it is not affecting at all. So that is one main thing. But a strict no is actually told to certain things, mainly the tea, coffee thing. Yeah. So anything which can stimulate, because tea is also another thing is the tannin inside the tea will actually reduce the absorption in your gut. All the nutrients which you need, especially that is affecting the, and all the sweetened beverages which are coming to with preservatives, bottled things, and yeah, soya products is also one of the things which you need to avoid in thyroid disorders. Okay, so these this five, and of course then you have got the alcohol and the smoking for 3 months. See why I'm saying 3 months. That 3 months when you get everything into normal. See, when you what our subject today is actually reversing thyroid. So when you are reversing it in 3 months, we need result, because we are all busy. We cannot go on forever. I also tell people here, after that, once in a while, if you take 1 or 2 no items also, it is okay, because we cannot. Our mind is always what we call wavering. We need to have that. Not regularly, but So when you're a serious patient, then we need to follow it strictly for 3 months. Okay, so that is actually one thing. And another thing is what we found is, which was given a very good results, are actually changing of the vessels. So when you store your food in the plastic, it is not good. When you cook your thing in aluminum or what do you call the now that iodized things which are coming, it is not advised. Instead, if you could go for earthen pots or stainless steel items, good quality stainless steel items, it is found to be very good, and the result is also very fast. So those are the things which are actually thing. And we normally, as Ayurvedic doctors, we suggest instead of iodized salt, which is again using chemicals, we suggest that you go for rock salt. Okay, because what we found is the preparation of that white colored thing, they are using a lot of bleaching powders and other things, bleaching in the processes, which is not advised at all. Okay, so next please. So next is actually the regimen. So we are mixing of this the daily routine. So what I normally I am more concentrating on this regimen part recently, and I found very good result with that regimen alone. Why the thing is, from the time you get up, within 2.5 hours, from the time you open your eyes, the 2.5 hours, you should have your breakfast. That is, many ladies are actually falling short of that because they eat late. So I tell them, see, as soon as you get up, you drink a lot of water, then you eat. If you are not able to cook or do anything, then at least eat nuts and fruits. Only the fruits exception is on empty stomach. We do not advise people to eat SAR, this citrus groups and other SAR foods, which has to be avoided on empty stomach. Other times we can eat it. So that is one thing which mainly has to be good. And then a balanced diet. So avoiding all the preservatives, avoiding all the chemicals. So because this is all autoimmune disorders, we don't want to feed that allergic reaction or your it's like when infighting is going on, we don't want people to increase that thing by bringing in other people from outside also. That will cause to more things. So no new item has to be tried out when you are in this 3 months of your treatment, because we want to reverse it within 3 months. That is our target, and normally by God's grace we are able to do it if you do it properly. So that's what we are seeing. Okay, so the proper exercise and that eating habit is actually morning you should eat, and when you feel hungry only the next food, not because it is 1 o'clock and your company has given a lunch break that you should eat. So you should take it a time. You tell them I work during this time and I eat little late. When you feel hungry, you eat eating it. That would be great. Okay, so that is another thing which we need to take care. And the drinking of water, I normally suggest, what I found very useful is according to your body weight. Every 20 kgs in India or a tropical country, you should drink 1 liter. And if you are in a temperate climate, you should drink 750 ml per 20 kgs of body weight. Okay, so that is one thing which we need to correct. So that when you correct it, and when you should not drink water. When you are hungry, you should not drink water. So many ladies make that mistake in India. So that is actually what you have found is creating a lot of acidity and slow diseases thing, especially skin diseases, thyroid thing, and everything is actually coming under that. So that is one another thing. When you are hungry, you should not drink. When you are eating, you should have sips of water when you are eating, and within 1 hour of eating, and after 7 p.m. because after 7 p.m. is you need to go to bed, and we don't want you to get up during your sleep, because you should get a very good sleep. That should be our main aim. Stress. If you sleep very well, if you feel hungry and eat very well, and if you defecate or you clean your toxins very well, and you breathe deeply, you should be healthy. So that is what we are actually trying to concentrate on. And another thing is, which I wanted to add to this, which part we always tell, is when you take bath also, there is one point which your forefathers were doing. You first pour the water on your feet, and when it is cool only, then you pour onto your knee, and then to your hip, and then go up. Because sudden pouring of water onto your head, as we do it in a shower and thing, immediately cools the head. And that heat is actually transferred to the body, which actually leading to too much of acidity and other complications. So if you change these two things in the regimen, you can see a lot of changes. So drink, proper eating, proper exercises, proper drinking of water, taking of bath. If you take a thing, you can see a lot of differences and in your all your diseases, not only thyroid. Most of the diseases will be cured by that. And not much doctors are actually concentrating on the preventive side, though we learn it and we don't tell it out. So that is one thing which we need to tell it out. Next thing. So that this specifically for thyroid, recently have found that. See, though when we say all the nuts are good, the walnut has got its special. So the shape is also like a brain thing. If you break the nut and see, it's like somewhat like a confused thing, no? The irregular shape, and it's like a brain matter. And even thyroid, if you look at it in our anatomical thing, it looks like that. So what we found is the walnut taking in, that doesn't mean that you should take it in excess. So that is, anything in excess is also dangerous. So we asked people to take a few, 3-4 pieces of walnut twice a day, and then applying the walnut oil. So massaging it, normally we say at night, just after you come from your stressful work. So when you massage it up and down around your neck, especially in the front part of your neck where the thyroid gland is situated, it gives a lot of help. We have seen it's like you are pacifying the child. So what a child which is crying, when you pacify it grows normally and well. So the affected gland. So that's what I always felt when you do a massage. Actually, when your part is affected, you give it a very slow and smooth thing instead of a very hard massage. Hard massage is needed for people who want to lose something, so that too much of fat, too much of hardened skin or something like that, then you need to do a hard massage. Otherwise, go pacifying slow and calm the particular part of that body, and then that will help it to clear. But it pacified, and slowly the circulation, nerves, everything gets pacified, and slowly the organ also will get improved. Okay, walnut oil can be specifically for massage, but we advise is walnut. Next, please. So I think I have actually come to the thing. So I just pushed on some concepts. So which you can think it over, and because these are all things which cannot be done unless you have a physician, Ayurvedic person who knows about it and who can do it along with you, depending on your own constitution and your own situations, because that is also there. Because recently now what we find is many people work throughout the night, so for them the entire thing is entirely different. Okay, so I think I'll take the questions now. Yeah, I think one question which I saw is what is the diet recommended for thyroid disorder? So I think I have answered it almost. Have I not? Yeah. So can I stop the allopathy medicine completely after start using Ayurveda for hypothyroidism? Any early warning signs of thyroid? Yeah, that's good two questions to say. So that is actually, yeah, when you are prone to thyroid, your family, there's a family history of thyroid, you have to be very careful. So that is first thing. So then I think I would prefer to go for instead of T3, T4, not instead of, in addition to T3, T4, TSH, you do your thyroid antibody test. So that will give you a little more clearer picture. That's what I understand from my own practice. And the early signs of thyroid is actually the stress when you are not sleeping properly, and when you are not resting, then your exercise, especially of the neck, each time when you do, if you are in IT field, especially you need to do that. I normally suggest all the IT people, they should at least stand up and walk every 45 minutes. Just tell your boss that, okay, I need to go to the toilet, or I need to drink some water, I need to have some coffee. Something like that, just move. And if possible, any person coming to your cubicle or whatever it is, your desk, just stand up. It will look also good, because I think even if it is a senior or a junior, if you just stand up to talk to them, so that actually relaxes your back. So when the blood flow in your system is actually better, then most of your other diseases are not coming. So that if you are lacking exercises, you should learn a lot of exercises which can be done on the chair itself. There are actually a lot of exercises which can be done on the chair. And ladies, especially, what I suggest is, because they are very busy people, I always admire them. So they are the devis, the goddesses. So they need to be taken care. So what I tell them, so as soon as you get up from your bed, do your exercises on the bed itself. Okay, so then you need not strain your muscles too much. That is one thing which we need to take care. Then the question about what is how to find it out earlier. It's the mild thing. So sometimes it will be the sensitivity, heat, irritability, get irritated, and then that little hair, tiredness, you are not feeling hungry, or there are sudden changes in your weight. So these are all menstrual complaints. These are all minor changes which we can see. Then we need to take care that, see, I should take care of my body. Otherwise, it will, when too much of this stress comes in, only the thyroid gets up. Initially, even many thyroid patients, they will show, like I said, not T3, T4, TSH will be normal. But only when you see the thyroid antibody, we see that it is positive. So that is actually one thing we are looking at. So that is another thing. And another two questions. Yeah. For kids, is it compulsory to use thyroid medication lifelong, or to prevent thyroid? Again, the same question as repeated. Yeah. One second. So for kids, yeah. So like I was telling, see, Ayurveda considers everything as a human being. So just like I said, when you are prone to it in your family history, when you were conceiving, at the time of that you had a history of thyroid and all, then you need to take care of the kids. So for kids only, right now what we are saying is, please try to get organic foods, not the so-called organic properly. If you can get it from your own sources, that will be best. And the vessels which I told, the cooking, the storing, the preservatives, these are all things which has to be avoided. So anything artificial can cause problem in the long run. So anything natural will help you out. So that is the two things which I need to tell you. So that is one main thing which we need to look into this. Okay, and see, the tea coffee thing I always suggest, because we are all, being South Indians, we are all addicted to some way or the other. We are addicted to tea or coffee. So I normally suggest, on empty stomach alone, you compulsorily avoid it. And if you are a thyroid patient, then you should avoid it compulsorily for 3 months. So that is no other go, because it fluctuates. Like I said, no, the absorption itself is getting affected. If you are in the leather industry, you might know that actually the leather, the tanning, the word tanning itself is meaning the hardening of the leather. So hardening of the leather means what happens? You use tanning. Tannin is a chemical, and the word for the process is called tanning, ING. So it hardens the leather to make your shoes, belts, bags, and everything. So when you are taking the tea as it is, what happens is actually you harden your intestinal mucus. So the absorption of vitamins and minerals are actually getting reduced. This is what we see now in most of the public now, because absorption is getting reduced. Even though if you take a very costly nutrients, even from a Nutrilite companies from US here, we see that they are not able to get full result. Because when I read their brochure also, initially, now they don't, the members who are selling it, they don't tell you. But actually the company tells that you should not drink tea or coffee when you are taking supplements. So that is not given much importance actually by these people who are selling for nutrition products. So because 2 hours before and 2 hours after, whatever you take, actually it affects everything. And when I said that, I actually wanted to add, I forgot to mention it, wanted to add one more thing. This coriander seeds, it is known to be having very good effect. So we normally say you take 1 tablespoon of coriander seeds and just dry fry it. That is actually normally I tell in a stainless steel vessel. Just heat the vessel, and when you off it, immediately put 1 tablespoon of coriander and then salt it. So because we don't want it to get too much fried, so that heat itself is enough. So when you salt it and then you slightly crush it, even with the spoon itself, you can just slightly crush it and then boil it in 1 liter of water and reduce it to half and keep it overnight. And the next day morning, slightly warm it and drink on empty stomach. So as soon as you get up, I normally suggest people to drink a lot of water. That can be done. And if it is warm water, it is still more good. So after that, maybe say 15-20 minutes later, after you go to your what do you call the morning cleansing, brushing, toilet, take some face washing and everything. After you do that, you drink this coriander water. It will help a lot. To really, because in our thing it is mentioned as a coolant and a cleanser, and now people are selling it has got a chelation property also. Those lead, arsenic, such things which are in your system through air, because you touch a newspaper and keep it in your mouth without knowing, without washing your thing, the lead in the printing ink itself is going to cause you a lot of problem in the later date. So that such things have been chelated, that is removed, broken and removed by coriander. So that way it is excellent. Okay. So I think I have covered all the things. And it is not compulsorily, see, if you follow the right, see, why we are here on this platform is to reverse the thyroid. So the question itself is, it's a compulsory to use thyroid medication lifelong. It's not needed because we taper it. If it is a severe case, we if it is a severe case, we ask them to continue the medicines, but taper it down slowly. If you are on a high dose of thyroid medications, we ask them to taper it down slowly. But if you are on a mild dose, you can actually get over it in within 3 days completely. And then you need to follow the regimen, because if you had seen my testimonials, you could see that people there get better, but then they have the symptoms slightly later on also, because they don't follow the thing. See, this is actually what I mentioned. Everything is to be followed lifelong, and it is nothing. Only certain things you can add, and it's not strict no to everything. You don't say like that. But initially, when you want the result, you need to completely follow a strict regimen. So it helps, because the regimen helps to strengthen you. One, it will strengthen your system, cleanse your system. It is fighting the disease. So all these things happening when you are following a strict regimen. So that is the importance of regimen. Okay. So I think I can end up with the section because not much other questions have been seen.
Thank you, doctor. That was quite insightful. Thank you for taking time. Thank you for explaining very elaborately, and thank you for your examples and also taking time to hear the questions that our audience have and solving them. So we have come to the end of the webinar, but before we close, I would like to thank Dr. Joy for taking time out of his busy schedule. Also, the audience who have taken the time today to join us, who have heard the session. And we do expect that after the session, you do go back and you visit our website. You see what Alternate Health has to offer. On that note, I would like to give a small feedback about what we do again in Alternative Health. So as I've stated in the beginning of the webinar, so we have a platform, Alternative Health, where we provide a telehealth platform for people who are looking for alternative options. We do have a wide scale of specialists in our vicinity. We do have Ayurveda, Aroma. Dr. Joy is also available. He's one of the specialists who you can contact in our website. You can also contact many other doctors which you are looking for in the case of Alternative Health. So these are also the companies that we have been associated with. So this webinar is conducted by Alternative Health, and we do believe you had a good session. We do believe that you have gained a lot of insight on what Dr. Joy had to offer throughout his session. And we do wish that you go back to our website, you check out the offers that the specialists that we have, the kind of therapies or the advices that we offer. And thank you, everybody. I hope you have a great day.